Okay, welcome everyone. Hi, Steve. Nice to meet you for the first time.
Nice to meet you, Stephen. Thanks for having me.
Yes, thank you. You gave a great lecture the other day, but this is the first time I've had a chance to meet you, so thank you for joining us. And is Dr. Pawluk with us?
I've called him. We're still trying to track him down, but at this time, no.
Okay, so maybe there's some kind of mix-up, but I will start anyway with Steve discussing fasting, and when Dr. Pawluk joins us, we can also incorporate PEMF. Okay, so why don't you just first take a minute just to tell us what you've been doing the last 15 years and about your book and just generally how you got to this point.
Well, certainly, yeah. So I'm a freelance reporter, and mostly I write about politics. But this latest book, published last fall, about the history and science of fasting and my own experience with it, is quite a diversion from my usual sort of fare. And the way I got to it was through fasting myself. I had become interested in fasting about 15, 20 years ago, in part because of the impressive benefits to longevity that had been demonstrated by fasting in lab animals, but also because I was like a lot of people. I kind of ate a version of the standard American diet. I put on a little weight each year, and I wanted to fast in order to help get the weight off. But over time, as my experience with fasting deepened, I became more and more curious about the science and the history of it. And, you know, I'd written a kind of mildly important article about fasting for Harper's Magazine back about 10, 12 years ago. Played a small role in the kind of rebirth that we're seeing of fasting in the last several years. I had been approached then to expand that into a book, and I said, you know, there's just not enough science to provide what I would feel would be a book-length treatment of fasting. It's very promising and it looks exciting, but I just don't think there's enough there. Over the last decade, the science has just blossomed in the most beautiful way. And so 2-3 years ago, I said, well, I think there's enough there now. And my own experience with it had grown, so I had more stories to tell about myself. And then the history of fasting had also just become very fascinating to me. So that's the genesis of this book. And it seems to be relatively well received. People appreciate hearing, what I have researched and put out there.
Okay, fantastic. So let's talk about fasting. There's a bunch of people watching this right now, and more or less, there's really virtually not a single one of us that is saying we'd like to stop eating. It's not, so it's really just a rational thing that the only question is, are the benefits significant enough for us to do it? So for a person that wants to get all the benefits, and I'll ask you about the benefits after, but first, just to discuss what we're actually talking about. There's a couple of different types of fasting. So if I stop eating, if I go to dinner at 6 o'clock and I stop eating at 6:45 and I don't eat the next day until 10:45, then I've gone 16 hours. And before we talk about the other types of fasting, are you saying, number one, yes, do this every day, go 16 hours between dinner and the next day, or is someone else saying that?
Well, the scientists and the doctors are certainly saying that. And I, as a reporter, am not giving medical advice and not telling any individual what they absolutely should do. But as a general rule, would we be better off fasting longer each night? Yes, that is what the science shows. And this is very, very cutting edge research that's really only been developed in the last 5 or 10 years, let's say. The first thing to know, so you're talking about daily fasting, which some people call intermittent fasting, which is separate from the prolonged fasting, which I'm sure we'll get to. The first thing to know about daily fasting is you are already doing it. I'm already doing it. Everyone on this planet is doing it, right? Except maybe a baby that's nursing 24 hours around the clock or something. So what scientists did in the last decade or so was to stop and say, well, if we're all fasting anyway, what's the healthiest form of fasting? Would we be healthier if our overnight fast, for most people it's overnight, were longer or shorter? And what they found, just to greatly simplify things, is we are healthier when our fasts are longer. And there's a very simple reason for that. And this works for This is why prolonged fasting is so beneficial for health as well. One of the biggest things that we do, that our bodies do each day, is digest our food, process the nutrients from those food, send those nutrients to trillions of cells all over our body, and then the cells do all their things with those nutrients as well. It's an enormous labor. When we give our bodies a break from that enormous labor, they take advantage of the break to accelerate their habitual repairs. Because see, our bodies, they're these, just marvelous self-healing machines that are making repairs all the time, that are saving us from cancer, that are saving us from all sorts of things. If our bodies didn't do this, not many of us would be here even just a few years from now. What happens in fasting, though, is most of the time when we're eating, those repairs go on at a very, very low rate because our body's busy doing all the other stuff that makes up our lives, including all this processing of nutrients and putting them to work and so on. But with fasting, it gets a break from all that heavy labor, and it takes advantage during that break of the rest to ramp up the repairs. And that is where the benefits from both daily fasting and prolonged multi-day, multi-week fasting comes from.
So as terms of an action step, though, the specific action step to get the benefit, I'm saying is a 16-hour fast. Are you saying is 16 a magical number versus 14 or 18? What's ideal?
Yeah, good, perfect question. Thanks for nudging me. I didn't answer that in your original question. So here's the deal. Here's what scientists have found. The best science we have so far suggests you will improve your health and you will increase the number of repairs your body makes starting at a fast of 12 hours every night. All right. And the repairs that you will get will increase not just sort of step by step, but almost exponentially with every hour you add to that 12. So you start getting healthier and healthier with 12-hour fasts, even more healthy at 13, 14, 15. So 16 is better than 12. It appears that 18 is better than 16. So that would be putting all your, eating into a 6-hour window each day. Now, scientists have yet to really determine whether an even skinnier window, say a 4-hour eating window for a 20-hour fast or a 2-hour window for a 22-hour fast, they have yet to really test whether that is effective. So we don't know what the perfect number is, all right? But it appears to be the case that if you can put all your food into a 6-hour, all your calories, I should say, food or drink, into a 6-hour window each day, you will maximize these repairs. However, if you don't want to cram all your food into that window, if you have a work schedule that doesn't allow you to do that, if you can do it, put all your food and other calories into 12 hours or fewer each day, you will get some benefit. And the other thing that I should add is most of us who do this, if you say a 6-hour and 8-hour window to someone, a 18-hour or 16-hour fast, what they do is they skip breakfast and they fast from from say noon to 6 o'clock or 8 o'clock at night. The other big discovery about this daily fasting that scientists have just very recently made is that it is actually not healthy to stack our calories later in the day. Our circadian rhythms have hardwired us to process calories most efficiently in the morning and in the early afternoon. So, and if you eat later at night, you interrupt some of these repair processes that I'm alluding to here. So the healthiest window so far that we can tell from the best science we've got is one that starts an hour or two after someone wakes up and finishes about 6 hours later. So maybe from 8 a.m. to 2 p.m. That sounds crazy to a lot of people I know. Believe me, I hated it when I heard it myself because I loved to eat late at night. I loved to skip breakfast. I love to drink late at night. I mean, the whole 9 yards. But it actually turns out that even if you can't put all your calories in that 6-hour window, if you put the majority of your calories in that window, so you eat a larger breakfast, a larger lunch, and then just keep dinner on the early side and the lighter side, you can probably still get a lot of the benefits of a 6-hour early window, even if you're eating in 10 hours or 12 hours across the day, just by stacking more of your calories earlier in the day.
So if I could do 11 a.m. and 5 p.m., that would be ideal. You're saying 10 a.m. and 4 p.m. would be even better, and 9 a.m. and 3 p.m. would be even more ideal. And the ultimate would be 8 a.m. and 2 p.m. being your last meal of the day.
Something like that. We can't narrow it down to, yes, we have a study that shows exactly these hours are exactly right for every single person, right? It's just not that precise. The science is not that developed. But we do have studies that show generally that what you're saying is accurate. The earlier your eating window, that 8 to 2 window, is better than an 11 to 5 window.
And 18 hours is a little bit better than 16 hours, we believe?
Correct.
So you're saying that if a person wants to take an additional meaningful step for their health, if every day they narrowed their window of eating to 8 hours, ideally 6 hours, and that 6 hours, the end of it was earlier, ideally 5 p.m., 6 p.m., or better 5 p.m., or better 4 p.m., then this would be a significant step that they could take to benefit their health.
That's what the research says. Exactly right.
Okay, so assume we do this 365 days of the year. We're good. Now, what other additional fasting is ideal? Do we do a 3-day fast, a 7 to 20? How often? So what's next?
Yeah. So it depends whether we're healthy or unhealthy. All right. So we should probably hop back a step and say that while when you eat is very important and too long, I believe, neglected, what you eat is still the primary thing, right? You need to eat a diet of, I believe the healthiest diet is one of minimally processed plants. If you are eating that diet and you have no diagnosed disorders, you're not taking any medications, all is going well in your life, you probably do not need to do a lot of prolonged fasting. Prolonged fasting is especially good at, well, I should say first, daily fasting seems to be very good at preventing disease. Prolonged fasting, probably useful for that too, but where it really shines and just outshines the daily fasting is at reversing diseases. If you don't have rheumatoid arthritis or fibromyalgia or ulcerative colitis or high blood pressure or type 2 diabetes or one of any of the other many diseases that prolonged fasting is very useful at reversing, you may not need to do a prolonged fast very often. Now, let's pretend we're all healthy, we're all eating the diets, we don't have any, disorders. How often should we fast? The short answer is we do not have great research to tell us, so we have to rely on clinical reports from fasting doctors who run fasting clinics, like Dr. Alan Goldhammer, I know, who's appeared at this conference multiple times, who runs America's largest and oldest fasting center, the True North Health Center in Northern California. What he advises, and this is similar advice to advice that other clinics give, is, come do a prolonged fast of 7 days. If during those 7 days with us, you do not experience any symptoms that would indicate that you are going through some sort of healing crisis, which would in turn indicate that you have some underlying hidden condition that your body may be trying to heal. If it all goes smooth, you're not overly nauseated, you're not vomiting, you don't have killer fatigue, etc. After 7 days, you're done. Come back and see us again in a year or two. So short answer, that's the long answer. Short answer is probably about a week, using it semi-diagnostically to see how it goes every year or 2 years.
Okay. And what about going longer than 7 days? I know at Dr. Goldhammer's retreat, they often go longer than that. So if you're healthy, do you still is it better to go 14 days if you can?
We don't have any indication that would be the case. It's sort of, you can view fasting as a kind of therapy. Should you take chemotherapy drugs if you don't have cancer? Probably not, right? Now, fasting is healthier for you than taking chemotherapy. So I'm doing a little bit of an apple and orange comparison here, but it is similar in the respect that, the reason to do the prolonged fast is to sort of, tie up any loose ends, to catch you in any little slippages you've had. Maybe you weren't perfect on that, whole food plant diet throughout the year. Maybe you had a few glasses of wine. Maybe you went out to dinner and had, restaurant food that's fatty, oily, salty, sugary, and all that stuff. The prolonged fast, the hope is, now again, I should emphasize, we do not have research to verify this, but we do have clinical observations that suggest this may be the case. The hope is that sort of wraps up all those, cleanses all those minor problems that might have happened in you. And for that matter, most of us are breathing polluted air. We're exposed to other toxins and carcinogens. So a week-long fast may be useful for that. We don't have any indication that a 2-week fast or a 3-week fast or a 4-week fast is useful. If you have enough fat stores and you're not having any terrible symptoms, it probably will not hurt you to do a longer fast. And if you did have something deeper wrong with you that fasting could repair, then certainly a longer fast would be helpful. But it's all guesswork, right? We just simply don't know. The longer fasts that you're talking about are usually used by people who have some kind of disorder. And, if you walk in the door at True North or at Buchinger Wilhelmi, the largest fasting clinic in Germany, if you walk in the door there and you've had rheumatoid arthritis for 10 years, or you've had type 2 diabetes for 5 years, you're not going to reverse that in a single fast of a week. You may need a 2-week fast or a 4-week fast, or even a 40-day fast if you have the fat stores and can do that. For that matter, you may need to repeat that fast every 6 months or year or so if it seems to be helping your condition, but your condition hasn't completely gone away with that amount of fasting.
Now, what if someone says, it sounds great, but the next 2 years, I am not going to have a chance to go to a fasting clinic. So I'm going to do the daily 16 or 18 hours, but I also want to get the benefit of longer fasts. What do you tell someone who is not leaving their home, but is very motivated and will follow careful instructions? Should they do water fasting, and for how long and how often?
Yeah, so there is what I tell them is what the doctors who I've interviewed have told me, and that is that they're split on their opinions. So Alan Goldhammer, for instance, says no one should ever fast on their own, doing a prolonged water-only fast on their own at home for more than 24 hours. He may even say for no more than 18 hours, if I recall. And the reason for that is there are people out there, there are very, very few of them, and we're talking rare disorders that these people have, where they can't process the byproducts that your body develops on a fast. Some people can't even run their bodies on their own fat as fuel during a fast. And of course, that's what you run on for most of your fasts is your fat stores. So if you can't use that for fuel, you have a high probability of ending up in a coma and maybe even dying if things get bad enough. So he says, because there are people like that out there, and we don't know the identity of absolutely every single one of them, no one should fast for more than 24 hours on their own. The other view, by people like, let's say, Dr. Michael Clapper, who worked for Alan Goldhammer and who has been on this conference, I'm pretty sure, multiple times as well, is that, look, yes, these people exist. They are exceedingly rare. They just simply do not really enter into the equation. They're that rare. So if you are in good health, meaning you have no diagnoses, you don't suspect any diagnoses, no disorder going on, you're not taking any medications, because medications, the effects of medications, both the intended effects and the side effects of medications, get greatly magnified on a fast. If you don't have any of those things and you're basically healthy, you can fast on your own for up to a week. Just pay attention to, if anything starts feeling funny or wonky or something, break your fast. But for those people, fast at home for a week. A perhaps compromise is that there are a few places, not many, that will supervise your fast remotely. But I think there are only maybe 2 places that will possibly even do that. I have a list of fasting doctors on my website, which is stevehendricks.org. If you go to the fasting frequently asked questions page, you can see the very short list there. But what they will do is they will say, I will supervise your fast remotely so long as you can get into your local hospital or clinic or whatever and do periodic blood work or urine work. And it is vastly cheaper than going to a fasting clinic. And obviously, you can do it from the convenience of your own home.
So based on all of your experience, and assume we do want to do something on our own, because assume for many people it's not realistic. So it's easier to do it at home with a supervised fasting. Again, is 7 days once a year the right amount, or is that too much for people? Should we do a 3? Should we do a 5? Like, what from experience, and as we want to get the benefits of fasting,
Yeah, exactly. 7 days, I think, is actually a very good amount. Again, you start going beyond 7, things can happen. Shorter than 7, there's some controversy. Now, if you want to do a little 3-day fast every so often, I have not seen any research that says that's extremely harmful. All right. You're not going to hurt yourself. And if you want to sort of try out fasting, with shorter fasts before you do a 7-day fast. Oh, let me try a 3-day fast. Let me try a 4-day fast, see how it feels. I've not seen any evidence that that's going to be harmful. However, as a kind of repeated practice, there are concerns. Fasting doctors have expressed to me, and the concern is this. So our body wants to run on glucose. That's its favorite fuel. It's just the carbohydrates from our food, right? When we take that glucose away, it switches over to burning our fat. It breaks down the fat into ketone bodies, and that's what it actually runs on, is the ketone bodies. Here's the catch. Your body doesn't just instantly switch the second you stop eating and run out of your glucose and glycogen stores. Glycogen's just chains of glucose that we keep stored around our body for backup fuel. You run out of your glucose and glycogen. Your body doesn't say, oh, okay, great. Now time to switch over to ketones. What your body does is it says, well, I'm anthropomorphizing a little here, but it basically says we want to make this as hard as possible. And so what it does is it burns, it still wants to have glucose. So it takes some of your protein and it breaks that down. And in a process called gluconeogenesis, it creates glucose from your protein. Now, that's a very inefficient process. It takes a lot of energy, which is why a lot of people, when they fast, find that days roughly when this happens, days say day 2 through day 3, maybe day 4 of the fast, depends on the person, their history, their metabolism, and so on. They feel like crap. It just feels terrible. And there's a reason for that. It's because their body is doing a lot of hard work. All right. We also don't know if you go through this protein burning phase, right? So let's say you just fasted 4 days. Your body switches over to protein. It's starting to burn a little bit of fat and ketone bodies as well, but it doesn't really fully get into ketosis, that state where it's burning all those ketone bodies like more than anything in the world. It doesn't get there. It just reaches that very difficult protein stage. Some fasting doctors have expressed to me, well, we are concerned about putting the body through the trauma of day 2, 3, and 4 of the fast without getting to that much more gentle ketosis fat burning stage where we think the repairs probably happen with much more than they happen in the earlier stage. So there's the concern that shorter fasts could be doing you a little harm. I will emphasize that that's concern. It's not, it's theory. It's not based in, we have research, we have studies that show this, that, and the other. And the final thing I'll add on that point is when people hear, oh, well, gosh, if I fast, I'm going to burn some of my protein. If I do a week-long fast, I'm going to have 2, 3, 4 days in there where I'm going to be burning some protein. They get really concerned. They imagine their muscles being eaten away or their heart being, emaciated or something. That's not what happens. You may lose a teeny bit of muscle, but here's what is going on, at least what it seems to be that's happening. And that's that when you fast, your body has a preference for breaking down unuseful things first. All right. So it seems in certainly other tissue that your body gets rid of things that your body doesn't need. It's quite probable from the research, it's not a sure thing, but it looks quite probable that the protein that's burned is old and useless protein that would have probably given you trouble somewhere down the line. It was could have been defective or worn out in some way. What happens is you get rid of it during your fast. After your fast, when you refeed, you regenerate it with healthy, you replace it with healthy new protein. So that loss of protein may actually be a good thing, but because we don't know for sure, and it could be a very taxing, slightly harmful thing, fasting doctors, that's why they say, please don't come to our clinic and fast with us for 4 days. Come and fast with us for a week or more. It's not just that they want to make money off of you. They actually do have a pretty good hypothesis in a kind of first do no harm kind of way. Like, look, we don't know, but we have this concern. So let's just be sure. Let's do a fast of no shorter than 5 or 6 days, ideally 7.
So what have you personally decided for yourself? Do you go to a clinic? Do you do it at home? Do you do it for 3 days, a week? What have you decided?
Yeah. So for the longer term fasts, first of all, I should say I don't consider myself fully healthy. I had a period of very bad health in my 40s and earlier. I'm 52 now. And so I consider myself still in recovery, even though I have been what most people would call healthy for the last, I guess it's been about 4 years now. So I fast twice a year for 1 week at home. If I feel a need for a longer fast, I go to a clinic. So just this past February, for instance, a few months ago, I went to a fasting clinic in Puerto Rico because actually while I was completing my book here, it was a period of very intense stress. I developed a case of tinnitus, ringing in my ears. I didn't have anything else wrong with me, but this tinnitus has persisted. So I went to Puerto Rico. I fasted for, I believe it was 29 days. Which is something I would absolutely never do at home. I wouldn't do at home anyway, but especially me with my body now, I don't have a whole lot of weight to give. So when you start getting lower and lower and lower in weight, you definitely want to have a doctor who knows what they're doing, looking at all your readings and so on and saying, is this, is it time to call off the fast because you just don't have any more to give? So that's my practice. My wife, who is exceedingly healthy, has nothing that we know that's wrong with her. She fasts once a year for 7 days at home.
So overall, in conclusion of the protocol, we're saying that there's a guy in Costa Rica, Lauren Lockman, with Tanglewood Wellness, and I called him once and I asked him about fasting, and he said very clearly that 7 days, just nothing, you don't get it nearly, the progress happens later. You got to do it longer. And he felt very strongly that the real benefits don't happen in 7 days, they happen in longer fasts. Any thought on that?
I don't believe the science backs him up. And I say that because we have studies. There was a very famous, at least famous in the fasting world, study, for example, of people who fasted for rheumatoid arthritis. I believe the average fast was right about a week, maybe a little flexibility, but certainly no more than 10 days. It wasn't a 2 week or 2 month or anything like that fast. It was a week of fasting followed by, for the remainder of the year, they ate first a vegan diet and then later in the year a vegetarian diet. During their fast, they improved on basically every metric that the researchers looked at. Number of swollen joints, degree of swollenness in their joints, degree of tenderness, grip strength in the morning when they woke up, amount of pain, how many painkillers they took, overall assessment of health. This all improved in 7 days of fasting. All right. And was maintained with the plant-forward diet that they did for the remaining, 12 months of the study. So, and we don't have 1,000 studies that show this, but we do have study after study after study that shows this. Goldhammer, along with T. Colin Campbell, did a very famous study in the fasting world on blood pressure. And on a fast of just 10 days, they lowered people's blood pressure, people who had high blood pressure, lower than any intervention had ever done before, better than any pill, better than any procedure. The average drop in people's high blood pressure was 37 over 13 points. That is twice at least what a very successful pill can do. And the people with the worst high blood pressure, stage 3 hypertension, I think it's called stage 4 now, their top number, the systolic number in a blood pressure reading, dropped 60 points, 60. That is off the charts in just 10 days. And believe me, even within just 7, it had probably dropped about 40 points or so. So you can get some enormous benefits in a short amount of time. That said, story after story after story of people who go, they fast, they get no improvement the first week, no improvement the second week, and all of a sudden, maybe the third week, they start to notice something changing. And by the 4th week, they've got a lot changing. By the 5th week, they've got their health back. So it is true that longer fasts are often needed for particularly more persistent conditions. But it's not true that a 7-day fast is not going to get you anything.
So if we did want to, have someone supervise our fast over Zoom or the phone and do it at home, or B, we wanted to go to Alan Goldhammer's True North, where else is there? How do you find a person who will supervise it at home? And if you don't live near True North, what are other fasting places in the United States that are available? Any guidance on this?
Yeah, there are only 3 inpatient clinics in the United States with doctors full-time trained to supervise fasting, and that's True North in California. Gracie Ewan, a chiropractor in Ohio, runs an outfit called, I think it's Dr. Gracie's Wellness Retreat. And Dr. Asa Fry and Dr. Joanna Fry, also chiropractors, run the retreat in Puerto Rico that I went to. It's called Clinica Back to the Garden. All these people were trained at True North. There may be other, True North is training people all the time. So there are other doctors around and about who may be capable of supervising fasting. But as far as people who've actually held out, put out a shingle and said, "This is a fasting clinic, come here and fast with us." That's it in the United States and all of the Western Hemisphere, I should say. There is one other doctor based in Southern California named Nathan Gershfield, and I think he calls his setup the Fasting Escape. It used to be residential; it no longer is. He only does fasting via the internet. So I believe he and maybe 1 or 2 of the doctors at True North, if I'm not mistaken, will do this long distance supervision of fasting. They have different conditions about what they will require. I think the doctors at True North may want you to actually enlist the help of a doctor who will be checking you out more regularly or something. I haven't gone down that road, so I'm not sure. So that's it in the Western Hemisphere. If you're in the Eastern Hemisphere, there are many fasting clinics in Europe, especially in Germany. And I believe there's still one in Australia, but it's a small universe.
And what was the second one, Dr. Gracias? Where was that? In Ohio?
Gracie Ewan, Yuen. It's in Ohio, sort of, I think between Cleveland and Columbus, if I remember, and it's called Dr. Gracie's Wellness Retreat.
Okay. Okay. So these are
all of those, I should say, Stephen, sorry to interrupt, but those are all listed on the frequently asked questions page of my website, stevehendricks.org, if anyone didn't or wasn't able to jot all that down.
So if we decide to do this at home, one more time, the same exact question. If we do it 7 days, is this something that you're saying this could be dangerous, you could die? Or are you saying we've done 10,000 of these, no one's ever died, no one's ever had to go to the hospital? Like, are there cases when this is dangerous? I mean, that we really should always have a supervisor, or how do we think this through?
Yeah, so I will say I am not aware of anyone who has done anyone. Remember, the criterion here is you are in good health, right? You don't have a diagnosis. You're not taking medication. So we're only talking about healthy people here. I'm not aware of any record of healthy people fasting for 7 days and dying. Now, unlike, Alan Goldhammer, I haven't, run a clinic that supervises 20,000 fasts or like the Buchinger-Wilhelmi family in Germany, whose clinic has been open for more than a century and supervised 250,000 fasts. I don't know the entire history of fasting, but I will tell you that it seems to be extraordinarily safe. I do want to pass on, for instance, Goldhammer's concerns, though, because again, I'm not a scientist, I'm not a doctor, I don't have all the possible information here. But to answer your question straight on, no, I do not know of any healthy people dying in a fast as short as 7 days. I know of healthy people who tried longer fasts and took it too far. And they died after, 32 days or 52 days or something like that. But in this short amount of time, no, I have not seen a record of someone's death.
And how many people do you know that have done 7-day fasts that were okay? Like, I understand you're saying you don't know any bad outcomes. Do you know of 3 good outcomes? Do you know of 300 good outcomes? Do you know of 3,000 good outcomes? What's the ratio? It's good that you don't know any bad ones, but do you know a lot of good ones or just a few?
Well, we know that, these fasting clinics, for instance, True North has fasted more than 20,000 people. Every person who's walked in the door has walked out, and virtually every person who's fasted has fasted at least 7 days. So, we know that it's safe under supervision. Myself, how many people do I know who have fasted 7 or more days personally in my own life, or people who've been in touch with me by email? I don't know, 50 to 100. I don't keep track, but scores and scores of people.
Okay. So let's assume you read about it, plan it, and get ready to do a week-long fast, whether it's supervised or you're doing it yourself. How do you do it? In other words, you start getting hungry at dinner time and you're on day 1. You're drinking water. It's day 1. How in the world are you getting through 7 days of not eating?
Yeah. So drinking water does help. Believe it or not, advice that I was given, when I did my first long fast was to imagine hunger when it strikes, an image of food of something as like a little pop-up ad or something. And you just click the red X, up in the corner to close that ad, and the thought will go away. And I was told this, and I thought that is the stupidest thing in the world. I mean, who could possibly make hunger go away like that? It actually worked for me. Now, I'm not saying it would work for absolutely every person who fasts, but it worked for me, and I've spoken with a lot of other people for whom that has worked. So that's, to get you through the first day or two, you might try little techniques like that, drinking a lot of water, and doing your best just not to think about food. The good news is this: many people, I've been talking about fasts of a week or 2 weeks or 40 days or whatever. And people who haven't fasted before must be sitting there thinking, I could never do that. I'd eat my fingernails off with hunger or something. And I'm in that boat too. If I were hungry the whole time, I could not do a fast of 29 days. Here's what happens though. When you burn that fat and you break down the fat into the ketone bodies, those ketones suppress hunger hormones. So we have hunger and satiety hormones like ghrelin and leptin. And what happens is that the more ketones you burn, the more they suppress your hunger hormones. So most people who've never fasted before report when they do a longer fast that they simply stop feeling hunger by the second day, maybe the third day. If you've done a lot of fasts before, you're very experienced in it, it seems to have an effect sort of like exercise. The more you do it, the better you get at it, the easier it is. And those people like me who've done a lot of fasting, I don't have hunger at all, just none whatsoever. It's important to emphasize, I'm talking about physiological hunger. All right. So you will not have a physiological basis for hunger if you're a normal human. There may be some outliers out there who, whatever reason, their ketones don't suppress their hunger hormones, 1 in a billion kind of people. But for everyone else, physiologically, you won't have hunger. However, hunger is not just physiological. All right. It's psychological. So this is why there have been many experiments in the past when people have been forced to fast. The scientists, the researchers, or doctors make people fast. Disasters, because inevitably, of course, they want to eat. So even though the ketones are suppressing their hunger hormones, right, they make themselves hungry by fantasizing about food. So that's the other piece of advice. You need to consciously make sure you don't let your mind run away in some fantasy. Yeah, sure. Like whatever your, favorite treat is, pops into mind during your fast. It's going to happen. Just don't dwell on it for 15 luscious minutes, like imagining the feel of it on your tongue and, how it's going to taste going down your throat and all that. Just don't do that. And most fasters who are motivated, who actually want to fast and aren't being forced to fast, have no problem with this. In fact, they have so little problem with this that at fasting clinics like the True North Health Center or Clinica Back to the Garden in Puerto Rico or Buchinger Wilhelmi in Germany, all these clinics offer cooking demonstrations to the people who are fasting because they want to teach them healthier ways of eating. Right? The fast is not going to do you any good if you go back to your unhealthy way of eating after the fast. These fasters, people who are fasting for 10 days, 20 days, 40 days, are sitting there watching people cook food. And then the people who've broken their fasts and are refeeding, they're watching them eat the food and they're not tempted. So it's completely doable. It's been done by millions of people over the last 2 centuries, but it does require that you actually want to fast and want not to get, psychologically wound up in your hunger fantasies.
When we talk about fasting, are we talking about 100% water fasting, 2, 100% green juice fasting, C, throw a little lemon in, 4, it's a fast, but you can have some tea and herbal things like, how much is this, which version are you talking about and what is necessary?
Yeah. So very good question. In North America, all the fasting doctors and clinics that I'm aware of do water only fasting. They do not want you putting lemon in your water. They do not want you drinking herbal tea. They certainly don't want you doing green juices. We're doing just fasting. Now, if there's some reason you have some physiological condition, they may, your kidneys show some sign of malfunctioning in the tests that they're running. They'll pull you off a fast and they'll put you on green juices to get you some calories until you can get back to normal functioning and see if they can restart your fast or not. But so far as the fasting is concerned, it's water only in the United States. In Europe, they have a different tradition, and it's called modified fasting. Modified fasting is giving you 250 thereabouts calories a day, chiefly in vegetable broths, maybe just a little bit of juice. What that does is it gives you just enough calories to have more energy than you would on a water-only fast. See, in a water-only fast, you're lying around doing nothing most of the day. If you get that 250 calories a day on a modified fast, well, you can do yoga classes, you can do stretching and flow classes, you can go for hikes out in the hills above the lake for an hour, 2 hours at a time. You have enough energy to do very pleasant spa-like things. However, you are still maintaining most of what's happening in fasting metabolism. The repairs that happen during a fast, patching up DNA, increasing your recycling of old and worn out parts of your cells that might cause disease if they weren't replaced, reduction of inflammation, on and on and on down this list of wonderful repairs that happen when we fast. Those still happen on a modified fast, all right? They're keeping you in a fasting metabolism, even with a small amount of carefully chosen calories. Okay, so the 2 questions, one about green juicing and one about, well, then if that's the case, why would anyone go through the hell of a water-only fast, which you're going to be more lethargic on? You can't do stuff. It's very hard to work for a lot of people when you could do a modified fast. The answer is that it does seem very strongly that you heal much more quickly if you're getting 0 calories. Again, remember the basic principle of fasting is you're giving your body a break, right, from the very heavy work of processing nutrients. So, okay, you're only processing 250 calories a day on a modified fast rather than your normal 2,000 or whatever it is. That's a lot better, but it's still work. And it does seem to inhibit some of the repair mechanisms of fasting, but not entirely. People who go and do modified fasting do get some fantastic repairs. I have heard of. I've interviewed people who have had fantastic turnarounds. I wrote about some of them in my book. So it's a really worthwhile thing to do. Green juices or juicing in generally is very hard to do and stay in a fasted state. I suppose in theory, if you kept it below 250 calories, it's possible. But what happens with juicing is, whatever you're juicing, you put in the fruit, the vegetable, whatever, you throw out all the fiber, you throw out most of the nutrients, you keep just the sugar and the water. So you're drinking sugar water. And typically people who do that, they're doing 400, 500, 600 calories a day. Now, you may get some benefits from that because what you're doing is eating a calorically restricted diet, but that's what you're doing. You are eating a calorically restricted diet, which does have benefits, some of which overlap with fasting, but you're not going to get all of the repairs that you would get on a water only or even a 250 calorie vegetable broth modified fast.
What about medicines and supplements? Should we consult a doctor about that, or do people normally not go? It is a fast, and forget about, yes, you should consult a doctor, I guess, according to what we need to say, but do fasting gurus or experts recommend that you avoid anything, including supplements and medicine? Is that the ideal?
Emphatically, yes, on a water-only fast. The supplements are, some of them are more potent than medicines. All of these things, supplements and medications, are meant to have an effect, and they often have unintended side effects. And as I alluded to earlier, those effects just get magnified when you're doing a fast. Now, remember that when those supplements or those medications were designed in a lab somewhere, they were designed for people who were eating, all right? If you take away your food and your metabolism changes, they were not designed for you. So you can have some terrible effects. Certainly if you were, just to take an extreme example, if you were a diabetic and you were a type 2 diabetic who was taking insulin, and you continued to take that during your fast, you're going to become hypoglycemic and you're going to be in an awful lot of trouble. But it's true for, sort of more garden variety drugs as well. So I'm aware of no fasting doctor who does water only fasting, who allows any of his or her patients to do such a fast while taking any medications, any supplements whatsoever. They have to be weaned off first. Quite often you go to the fasting clinic, you might spend the first week doing nothing but weaning off your medications if you happen to be taking some. In modified fasts, for instance, at the Buchinger Wilhelmi Clinic in Germany, in those fasts, they do allow supplementation. They do allow medications, but the dosage may need to be tweaked depending upon what the medication is, why you're taking it, and so on. But they allow that because you are, in fact, still digesting things. And so they believe that there's little harm to be had from continuing with most medications. There may be a few that they want you off of, but for the most part, they will do that because you've got an active stomach and intestinal tract, and it's going to be able to handle that stuff better than, if you just were drinking water.
Just as a disclaimer to our audience, The Real Truth About Health does not have any knowledge about medicine, so that is not something we get involved with, and you should speak to whoever's appropriate to get your advice on that. What about colonics during a fast? You get constipated. Should you do not colonics or enemas? Should we do enemas during a fast?
Yeah. So the best way to avoid, so the short answer is probably not on a water only fast, possibly so on a modified fast. The longer answer is, if you want to avoid constipation, eat plants that are high in fiber for the 3 days or so before you start the fast. Fiber, as we know, moves stuff through us quickly. You do not want animal products. You do not want highly processed foods. You don't want a bunch of oil. You may not even want things like nuts and avocado in there. You want, beans and, kale and potatoes and sweet potatoes and things like that in your diet for those. Hopefully they're in your diet all the time. But if they're not, for the 3 days before you fast, eat those. That way, when you stop eating, it should help move things through much more quickly. Okay. There is a long history of using enemas for fasting in Europe. All right. And their basic idea, I think, is look, we're kind of not eating, but we're kind of eating, right? We're giving them 250 calories a day in broths, a little juice, maybe a teeny bit of honey in the tea or something. And that's going into the stomach, but there's not a ton moving stuff all the way down through the system. And we're worried that stuff is going to, get into the intestines and just kind of sit there. And their clinical observation is that when that happens, people experience more headaches, more fatigue, sometimes more nausea. And in their estimation, when they give people enemas, which they tend to do approximately every 2 days during a fast, when they do that, people, have more energy. Their nausea goes away. They don't have headaches. So they do that, and they've done that for 100 years or so with what they believe is good results. We don't have any studies to say. The concern about fasting doctors who do water-only fasting is that first of all, you don't have that stuff in there constantly coming in as you do during a modified fast, okay? So you have your last few meals or whatever, but they will work their way through just fine 99.9% of the time is what the fasting doctors in the US tell me. And their concern is if we squirt liquid into the intestines, we are going to flush stuff out. Even if there's no food in there, we're going to flush stuff out that may be, let's say, electrolytes. And if we're flushing your electrolytes out, well, is that going to give you high blood pressure? Is that going to cause your kidneys or your liver to malfunction? And the basic idea that they have said to me, and it makes sense, is like, look, this fasting mechanism, our body's exquisite equilibrium that we go into when we don't have food for a while, was developed over 1 billion years of evolution. Some of these fasting mechanisms, the repair mechanisms in particular, but other stuff as well, we share with yeast, with whom we last had a common ancestor 1 billion years ago. So they say, look, nature has designed us to fast. Why should we go meddling with the fast with this enema that may change the balance of many things inside of us when we have no reason to believe that we know better than nature? So in the absence of that knowledge and in the absence of any compelling evidence that water-only fasters do better with an enema, they say avoid it.
Should we brush our teeth during fasts?
It's quite the question, because quite often your breath is going to reek horridly. It's called acetone breath. Acetone is one of the ketone bodies, and we all know acetone from, paint remover and nail polish remover and so on, right? So often the breath is just disgusting. Again, the modified fasting doctors say, sure, brush your teeth. I mean, we're feeding you anyway, 250 calories a day. What's a little bit of, toothpaste? The doctors in North America say no. Your body will absorb tiny amounts, but it will absorb tiny amounts of that toothpaste. And why throw that into your system and potentially throw off some of the repair mechanisms if we don't have to? So if you want to brush your teeth, if you really desperately do want to, do it without toothpaste. And you would actually be surprised at how much just brushing with water can clean up the sort of foul smell in your mouth. And I tried that for the first time on my 29-day fast, and actually just felt that it was fantastic. It was the first time I hadn't brushed my teeth with toothpaste during a fast. And from now on, I'm going to do it with just water because it worked just fine.
So a lot of information we get is we test things on ourselves. It's a very slow way to learn, and it's not ideal. And sometimes someone gets sick and they have one of 50 different diseases. And someone says to them, why don't you try water fasting? So the question is, instead of each person listening to this having to test it out and find out how it affects all the different diseases, is there any data of the 1 million people who have type 2 diabetes, the 1 million people with obesity, the 1 million with cancer, with heart disease, with kidney disease, who go on a water fast, let's assume, I don't know how long, 10 to 20 days. Do we know, does it have a meaningful result or change to any of these diseases so we don't have to experiment on our own? Is there already people who've tried this and could tell us what effect it has?
Yeah, short answer is no. We just don't have studies that large. You have to remember that fasting has been a research ghetto for ever since scientific research has evolved. No one has wanted to touch it. It was the field of quacks and kooks. And frankly, even though it has blossomed in the last decade, it is still largely that among most conventional scientists and certainly most conventional doctors. So we do not have large studies. We simply don't. What we do have is the clinical experience of fasting doctors who, over the last, I would say 75 years in particular, have done a very good job of reporting, fasting seems to work wonders for autoimmune diseases. It seems to do very effective against type 2 diabetes if the diabetes hasn't gone too long. It seems to do very good against some aspects of cardiovascular disease like high blood pressure and angina and so on. So, it's a long list of diseases that fasting can help. If I had to rattle it off, it would be 5 or 6 dozen different diseases. And the reason is this. It's because fasting is not working in one cell. It's not making these cellular repairs in one type of cell. It's not making it in one organ. It's not making it in one corner of the body. It's making these repairs in virtually, I don't want to say virtually every cell, but the vast majority of cells and the vast majority of organs all over our body. So it can repair and reverse a ton of disease. However, you're absolutely right on. There are some diseases it doesn't seem to do very well for at all. And it's useful to know those. All right. So, but that's another list. I will give you an example though. Fasting, we have case reports that are very compelling. In fact, I start my book with one that fasting seems to work very well for a form of lymphoma known as follicular lymphoma. It's a liqueform cancer. Fasting doesn't seem to do nearly as well and may, in fact, in some cases, make worse solid cancers. All right. So, if you have cancer of the pancreas or cancer of the liver, or if you have a melanoma or something like that, we don't have any evidence that fasting is going to help you. We do, however, I'll just say as an aside, we do have evidence that fasting in combination with more traditional therapies like chemotherapy and radiation, fasting seems to enhance the chemotherapy and radiation at its tumor killing work, and it seems to protect the body at the same time from the assaults of chemotherapy and radiation. But, I'm saying all this in order to give you a sense of we have a large amount of discussion of this in the fasting literature, which is not a vast body, but it amounts to doctors simply saying, people came to my clinic, fasted for this, and they got better.
Does it seem to be help cancer patients, or it seems to hurt them, or we really don't know?
If you were doing fasting alone, so we don't have enough data to say about in humans, but so that one of the leading researchers in this field of fasting and cancer is named Walter Longo. He's a professor at the University of Southern California. And his line after fasting, I don't know how many mice and how many rats and who knows what other kinds of animals in his lab was, yeah, you might save one, but you're going to kill one. So we can't possibly recommend something that's going to that we know if we tell you, okay, you've got pancreatic cancer, you should fast for it. We know some number of people are going to die from that advice, so we can't give that advice. Now, is it possible that some other people with pancreatic cancer would benefit from fasting, might even, contribute seriously to a remission? Yeah, it's possible, but we just don't have the evidence that would, merit making so bold a statement as that.
Okay, if you'd like to ask a question, please raise your hand. David would like to ask a question, and where are you from?
Hi, I'm David from Massachusetts, and I have two quick questions. First of all, follow up on Steve's question about supplements. There are many supplements that it's recommended to take on empty stomach, and because of it, you will get more benefit out of them. So for the daily fasting, does this supplement consider disturbing the fasting? So this is the first question, because if they are considering disturbing the fasting, it's kind of narrow expanding the window that you are eating. The second question is, there is a company that's doing fasting mimicking diet called Prolon, and they give you a kit of their food for 5 days, and they claim that when you eat their food, you get the benefit of Prolon fasting. I would like to ask if you're familiar with this and what are your thoughts about this? Thank you.
You bet. Good questions. So I'll take that second question first. Prolon is a company that was actually started by Walter Longo, this USC professor who I had just mentioned. There is excellent research behind it showing that people who eat this, and what it is it's a fasting mimicking diet, which is to say it's actual food, it's soups and little nut and date bars and things like that. And you eat it for, the ideal is you're eating it for, I believe it's 5 days, once a month. And the research that has been done on it shows that if people do that for, let's say, 3 months, they will find enormous, sizable improvements in their metabolic disorders. Their cholesterol, if it's high, will go down. Their blood pressure, if it's high, will go down. If they're insensitive to insulin, they will grow more sensitive to insulin, and so on. So it is I think it is very good. I do think, and I take Walter to task a little bit about for this in my book, I do think he overpromises. He has said it is just as good as fasting. Well, in order to design Prolon, what they did was they looked at 4 specific metrics, and I'm not sure if I can recall what they were, but 4 specific metrics of fasting. One was how much glucose do you have in you? One was, are you running on ketones? And I think one was what is your level of IGF-1? That's a hormone. It's a useful hormone in many ways, but too much of it can contribute to disease. And then there's a related binding protein called IGF-1 binding protein that they looked at as well. And they said if we bring all these markers, these 4 markers, all right, into the parameters, into the range that they would get to if you were actually fasting, then we can say that we have mimicked fasting with this diet. And I think that's partly true. They have mimicked those aspects of fasting, and those aspects of fasting are probably surrogates for others as well. And so they have, mimicked, more than just those 4 variables. It's true. The body has thousands and thousands of variables that change when fasting. We don't know what they all are. So to claim that you're going to be, you're going to get as much restorative benefit with an FMD, a fasting mimicking diet, as you will from an actual fast, I just don't think the evidence supports that at all. And I wish he would stop saying that. But is it useful? Absolutely. Not everyone wants to fast. That's why he designed it, because he was running into opposition from people fasting, and for that matter, from their doctors. So he's created this thing where he can get both doctor and patient on board. It's a great tool to have out there. For your other question, okay, so as I understand it, what you're asking is, so I do my daily eating period, my eating window closes, but I'm supposed to take this supplement on an empty stomach. So if I wait 2 hours or something till my stomach is empty, am I breaking my fast by doing that? And that's a very good question. The short answer is you may be. The longer answer is the best research we have says if you take 5 calories or more, you will break that fast. Okay, so 5 calories is 1.5 grapes. It's a teaspoon and a half of soy milk. All right, so if your supplement has 5 calories or more, yep, you're breaking your fast. You're ending your fasting period. You're pushing back your overnight repairs further into the night. The more complicated answer is your supplement may be fewer than 5 calories. All right, but if it's got other properties that interrupt your metabolism, say it has caffeine in it, which we know interrupts a fast, you will be interrupting your fast. Now, the catch is it may be a small interruption. We don't have the research to say. So we know that there's an interruption with some things, but we just don't know how big it is. And we don't have the specifics to say, okay, supplement with this ingredient, it breaks it this much. Supplement with that ingredient breaks it that much.
Elizabeth, would you like to ask a question, or where are you from?
Do you hear me?
Say
Yes.
it again. I'm sorry. Go ahead.
Okay. Hello. I'm from Quebec, Canada. So actually, I wanted to know if you have any research on fasting and mental disorder like depression or anxiety?
Yeah. Yeah, I spent a whole chapter of my book on it. So it turns out that when we think of fasting, most people think about, most doctors, fasting doctors over the years have talked about fasting for somatic disorders, disorders of the body, not disorders of the mind. Now, of course, you can't separate them, but for ease of conversation, I'm going to talk about it that way. So we have very little evidence, certainly in the US and the West, because fasting doctors just simply didn't fast patients for this reason. However, I mentioned earlier, I had a terrible health crisis in my 40s. It was chiefly psychiatric and neurological disorders. And it's a long story, and I think we're running out of time. So what I will say is that I did a fast 4 years ago simply to help myself lose a little bit of weight. When I did that, I noticed that my psychiatric disorders were going away. And eventually during this fast, they went away completely. And I tell the story of that in the book. This led me to look into what research did exist. And as I say, there's very little, but there is, however, a wealth of clinical experience. It's unfortunately all in Russia. So it turns out there was a fasting doctor named Yuri Nikolaev, who in the Soviet Union from the 1940s to the 1990s fasted extremely severely mentally ill people, mostly schizophrenics, mostly inpatients at his very large, very prestigious Moscow psychiatric hospital. And to cut to the chase, of these 10,000 patients or so that he fasted over this period, he reported, and I believe very credibly, success rates approaching, I think it was about 2/3 of his patients. When he put them on a long-term water-only fast, the typical fast was about a month, not only got better, but were able to maintain their recovery for years after they left the hospital. So it's a completely underexplored area. I do discuss the evidence, what little there is, the research in some detail in my book. If you have a psychiatric problem or a loved one who does, or a neurologic problem, I would highly recommend considering that. Again, in that case, absolutely fasting under supervision would be the way to go.
So if anyone would like to follow up with Steve, you can go to our website and you can find out about his book and his website or how to get in touch with him. Steve, you can unmute the mic also. We'd all like to thank you, Steve.
Next to Jim.
Hey, Steve, you're amazing.
Best way to get over
You're inspiring.
level is start your